Every morning I go on a 1.5-mile hike just to get my day started on the right foot. Before I was diagnosed, I lived a very healthy life, and then suddenly I was spitting up a little bit of blood. So I contacted my primary care physician and was ordered to get to an emergency room right away. Sure enough, a CT scan identified a mass in my left lung. They had diagnosed me with stage 4 adenocarcinoma lung cancer. I was told that I had 9 months to live without treatment, 18 months to live with treatment, and that I would begin a regimen of 4 to 6 chemotherapy treatments the following week. The CT scan after the 4th cycle showed that the chemotherapy was not working. My regional expert hospital referred me to Hopkins for an immunotherapy clinical trial in hopes that I would have some life-saving chance there.
When I first met Mr. Ryan, he was hoping to get onto a clinical trial with immunotherapy. Immune therapy is any therapy that we use to manipulate your own immune system to attack the cancer. This particular trial was just for patients with metastatic lung cancer who had previous chemotherapy.
I was chosen to participate in the anti-PD-1 immunotherapy drug arm of the trial. I would have a infusion every 2 weeks and a CT scan every 6 weeks. After 4 cycles of immunotherapy, my tumor had shrunk 65%, and subsequent immunotherapy infusions, my tumor shrank, and I came to a nadir, or a low point, of an 82% shrink, and I've remained at that stable condition to date through 71 infusions of immunotherapy drug.
His disease actually responded beautifully to the immune therapy, and he's done well, and the cancer has remained under control for a very long period of time, for years.
The more treatments I have means the less likely that I would have disease progression.
Clinical trials give people hope. You know, research really does give patients hope in the fact that we're hoping for improved quality of life, better survival, and we're still trying to really strive for a cure.
Having access to immunotherapy is truly a game changer, a lifesaver. I am grateful beyond all measure for what she has accomplished and what she has made available to patients with terminal disease. But the greater thinking is that if a patient can endure 2 years of immunotherapy, the likelihood is they'll die of something other than that cancer, which from somebody on the pointy end of the spear is exceedingly good news and an exceedingly rich source of hope.